You're standing at the bedside, the wound isn't healing, you suspect infection or biofilm. You open up the supply room and you've got silver dressings on one shelf and iodine dressings on the other. Which one do you grab? If you've ever stood there and generally been unsure, this video is for you. Because silver and iodine are two of the most commonly used antimicrobial dressings in wound care, and yet I see clinicians reach for them almost randomly without a clear clinical rationale. Today, we're going to fix that. I'm going to walk you through how each one works, what the latest research says, and give you a simple decision guide that you can actually use in your practice. So let's go. Before we compare them, I want to be very clear about what we are comparing. When I say silver dressings, I'm talking about dressings that contain silver ions as the antimicrobial agents. Things like silver foam, silver alginate, silver hydrofiber, and nanosilver. When I say iodine dressings, I'm specifically talking about cadexomer iodine, not straight povidone iodine. That distinction matters a lot, and I'll explain why in a minute. Both of these are antimicrobial dressings, meaning they're designed to reduce bacterial load in a wound. They're not your go-to for every wound. They're indicated for infected wounds, critically colonized wounds, or wounds with suspected biofilm. If the wound is healing cleanly, you don't need either of these. So let's start with silver. Silver has been used in medicine for over a century, long before antibiotics even existed. And modern silver dressings take that ancient antimicrobial power and deliver it in a controlled, sustained way directly to the wound. Here's how it works. Silver dressings release silver ions when they come in contact with the wound fluid. Those silver ions are toxic to bacteria. They disrupt bacterial cell walls, interfere with bacteria protein and DNA, and essentially kill it. The best part about silver is that bacteria have a very hard time developing a resistance to it. That's a big deal in the world of antibiotics resistance, and this is a growing crisis. What makes silver dressings particularly effective is that they work against a broad spectrum of bacteria, including some of the worst ones we see in chronic wounds, which are MRSA, Pseudomonas, E. coli. Silver works against all of these. Silver dressings also work against biofilm, that protective coating bacteria create to shield themselves against treatment. This is one of the reasons silver is often the first choice in chronic stalled wounds, because biofilm is frequently the reason that the wounds aren't progressing. In terms of wound environment, most silver dressings are also designed to manage exudate at the same time. A silver foam dressing, for example, is absorbing fluid and delivering silver ions all at the same time. That dual action makes them very practical as a wound dressing. Now, there are several types of silver dressings, and the type you choose does matter. It should match the drainage coming from the wound. Silver foam is great for moderate to heavy exudating wounds. It absorbs, it manages moisture, and it delivers silver. It can be used on pressure injuries, leg ulcers, surgical wounds. This is probably one of the most common silver formats. Silver alginate is used for heavy exudating wounds and can be also used as a packing for deep wounds. The alginate forms a gel as it absorbs, which helps keep the wound bed moist while delivering silver. Silver hydrofiber, similar to silver alginate, but it has a different fiber structure. Brands like Aquacel AG are very effective for heavy exudating infected wounds, including diabetic foot ulcers. Nanosilver is one of the most potent forms of silver delivery. Products like Acticoat release very high concentrations of silver ions, often used for burns and severely infected wounds. Each of these delivers silver differently and at different concentrations. The key point is match the format to the wound. Heavy drainage wound, silver alginate or hydrofiber. Moderate drainage with intact peri-wound skin, a silver foam. I will link some of the ones that I personally use down in the description below. Now let's talk about iodine. And I want to address something right away because iodine causes a lot of confusion among nurses. When most people hear iodine dressing, they think of povidone iodine, the brown liquid we've all seen used on skin before a procedure. And yes, povidone iodine is an antimicrobial, but used directly on the wound bed, the evidence just isn't there to support it for chronic wound management. It can be cytotoxic, meaning it can damage the healthy cells you're trying to protect. At high concentrations, it can actually slow healing. The iodine dressing we're comparing today is cadexomer iodine, and it's a completely different product. Cadexomer iodine brand names like Iodosorb or Iodaflex is a slow release iodine system. The iodine is embedded in a gel or starch-based dressing. As the dressing absorbs wound fluid, it slowly releases low concentration of iodine directly into the wound bed. It's a controlled release, so you get sustained antimicrobial action without the cytotoxic risk of straight povidone iodine. Cadexomer iodine does several things at once. It kills bacteria, it absorbs exudate, and it physically debrides slough as it swells and absorbs, and it creates an environment that supports healing. One particularly interesting property that cadexomer iodine has shows strong activity against Pseudomonas, which is one of the harder to treat bacteria in chronic wounds. Some evidence suggests it may actually outperform silver against certain specific organisms, including fungi and bacterial spores. So it's not a weaker option, it's a different option. So now let's look at what the research actually says, because this is where it gets really interesting. In 2024, a systematic review and meta-analysis published in the BMJ Open compared silver and iodine dressings head to head. This was a rigorous piece of research, 17 randomized controlled trials evaluating healing time, healing rate, exudate control, pain, and antimicrobial effectiveness. The headline finding, silver dressings significantly reduce healing time compared to iodine dressings overall. Now, that's an important result for silver. However, and this is really important for your clinical decision making, when researchers compared the two head to head in a randomized controlled trial of leg ulcers with bacterial burden, overall healing rates between silver and the iodine were comparable. What that tells us is that both dressings work. Silver may have an edge in healing speed for certain types of wounds, but iodine is not a lesser option. It has unique properties that make it a better choice in specific clinical situations. In vitro testing has shown cadexomer iodine can outperform nearly all antimicrobial silver dressings currently on the market in terms of speed of antimicrobial action. And for biofilm specifically, both have activity, but the approach is often sequential. Clinical guidance suggests using cadexomer iodine to disrupt and remove the biofilm, then step to a silver-based dressing to prevent the biofilm from reforming. That's a really useful framework, and I'll come back to that in the decision guide. The honest summary from the evidence, silver is a strong first-line choice for most infected chronic wounds. Cadexomer iodine is not inferior, it's different. It has specific scenarios where it has the edge. Let me put these side by side so you can see the key differences clearly. Antimicrobial spectrum, silver is used for broad spectrum and is an excellent source for MRSA, Pseudomonas, E. coli, gram-positive, and gram-negative bacteria. And it has strong biofilm activity. Iodine is also broad spectrum and actually has a broader activity than silver in some areas. It's better against fungi, bacterial endospores, and viruses. It is also strong against Pseudomonas. Next, how do they work? Silver releases silver ions that disrupt bacterial cell walls and DNA. Cadexomer iodine slowly releases controlled iodine that kills bacteria on contact and physically debrides slough. Debridement, silver has no debridement action. Iodine, yes, cadexomer iodine physically removes slough and debris as it absorbs. This is a significant advantage in wounds with heavy slough. Exudate management, silver, yes, depending on the format, silver foam, hydrofiber, and alginate handle exudate well. Iodine, yes, cadexomer iodine is highly absorbent. Pain on application, silver generally is well tolerated, while iodine can cause a constant stinging or pain on application in some patients. It is something worth warning patients about in advance. Contraindications, use with caution in patients with known silver allergies. Iodine, do not use in patients with thyroid disorders, those on lithium, pregnant or breastfeeding, or patients with wounds near their thyroid gland. This is a hard contraindication. Cost, both are in a similar price range for antimicrobial dressings, slightly above standard dressings, but well justified for infected wounds. All right, let's get in the decision guide. When do you reach for silver? Choose silver when the wound has signs of infection or critical colonization and you want a broad spectrum antimicrobial that's well tolerated and easy to manage. The wound has moderate to heavy exudate. Silver foam or silver alginate gives antimicrobial action and moisture management together. You're dealing with MRSA. Silver has excellent activity and is well established in MRSA positive wounds. The patient has a thyroid disorder, is pregnant, breastfeeding, or is on lithium, as iodine is contraindicated, so silver is your antimicrobial of choice. You're in a burn care or post-graft setting. Nanosilver has strong evidence in burns. The wound has been treated with cadexomer iodine and biofilm has been disrupted. So silver is a great dressing to step down for biofilm prevention and ongoing infection management. You want a dressing that can stay in place for 3 to 7 days. Many silver dressings can be worn for longer periods between changes, which is a practical advantage. Now, when do you choose cadexomer iodine? Choose cadexomer iodine when the wound has heavy slough or necrotic tissue alongside infection. Cadexomer iodine debridement action gives you a 2-for-1. You're treating the infection and helping to clean the wound bed at the same time. The wound is colonized with Pseudomonas. Cadexomer iodine has particularly strong evidence here. You're dealing with a wound that hasn't responded well to silver and you want to try a different antimicrobial. The wound is showing signs of biofilm. The sequence I mentioned earlier, use cadexomer iodine to disrupt and debride, then step to silver to prevent biofilm from reforming and maintain a clean wound environment. The patient has a wound with moderate exudate and significant slough. Cadexomer iodine handles both. One more important point, cadexomer iodine is not a long wear dressing. It needs to be changed every 2 to 3 days, sometimes daily in heavy exudating wounds. That frequency needs to be feasible for the patient and the care setting. And now the section that most people skip. When should neither of these dressings be used? Both silver and iodine are both antimicrobial dressings. They're not for routine wound management. Using them on a clean, healing wound is unnecessary, potentially harmful to healing tissue, and expensive. You should reassess and step down to a non-antimicrobial dressing when the wound is no longer showing signs of infection or critical colonization. The wound is actively progressing. It's getting smaller, the tissue's looking healthier, drainage has reduced. You've been using an antimicrobial for 2 to 4 weeks, and reassessment shows improvement. A good rule of thumb here is antimicrobial dressings should be reassessed every 2 weeks. If the clinical picture has improved, step down. Don't continue them indefinitely. And of course, neither of these dressings replace systematic antibiotics. In a wound that has spreading infection, cellulitis, or signs of systematic involvement, if your patient has fever, increased redness, spreading away from the wound, or is unwell, that needs medical review, not a dressing change. Now let's recap. Silver and iodine are both effective antimicrobial dressings for infective and critically colonized wounds. They work differently and they each have their strength. Reach for the silver when you want a well tolerated, broad spectrum antimicrobial that pairs exudate management with infection control. Reach for cadexomer iodine when the wound has heavy slough, you need debridement, or you're dealing with a biofilm that needs to be broken down first. Use them sequentially, iodine to disrupt biofilm, silver to prevent reformation when you're managing a complex stalled wound. And always reassess at 2 weeks. Antimicrobials are treatment phase, not a permanent dressing choice. If this video has helped make sense of silver versus iodine decision, please give it a thumbs up. It helps the content reach more nurses who need it. And if you have a specific wound scenario you're working through, drop it in the comments below. I love getting into the clinical details with you. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.